First off, I want to say thank you very much. I deeply appreciate the opportunity, and I want to congratulate you for the phenomenal initiative. To you, Drisha, Komal, Philo, Nitya, each one of you, and thank you guys for being here, Ritika and Purnima, Mandisa, and of course, needless to say, everybody else, lots of friends and family who are here. It's a grand pleasure, and I'm delighted. I wanted to say that I'm going to start off a little bit different from what our previous speakers who've given us great insights, and therefore I rather than repeat, sort of talk a little bit about a different perspective, and I hope that perspective will build on some of the important things that our previous guests and speakers have talked about. So let me start off by asking all of you to take a deep breath and a split second, close your eyes and reflect inward, building on what, like I said, some of our previous speakers have said. And I want you to write down in the chat box, and you can send it privately or you can send it to everyone, whatever you guys prefer. Just one thing that at this moment in time, as we speak, as we stand here together, I'm standing, you guys may be sitting, as we are here together, that you feel gratitude for. So if I can ask you to take a deep breath, think about it. It could be whatever. It could be work, family, access to the internet right now to connect here, whatever. What you've just heard Purnima and Ritika talk about, think about it. And write down what you feel grateful for, please. Okay, I'm going to ask all of you guys to keep processing your thoughts as we speak today, and I can hear a lot of voices through the chat box, but believe me, whether you write it down or whatever it may be, it's amplified through your voice. So your surroundings, life, family, friends, comfort, access to the internet, being part of the session, being conscientious about these issues that we're talking about right now. I want you to kind of keep that in your mind and in your heart as we spend time together here. We have a few minutes, but I want you to let that be part of at least our time together, and I hope beyond that as well. What I'm going to also do is I'm going to ask Komal, should I be projecting my slides here? Is that easy? That's easier, right? So I'm going to just share my screen. Okay, here we go. And I believe I'm up and running. Okay, so I can't get it into, okay, I have managed. All right, so what I wanted to say was that we're going to spend a few minutes together here today. And what I want us to be able to do is certainly think about what is of significance. Oopsie daisy, sorry, everything's out of control. I want you to think about what this pandemic is about, and look beyond, okay? I want you to look beyond, and therefore I chose this picture. I want you to be able to see the horizon, and I want you to think about what it is we need to know, and we've learned so much already, so thank you guys so much for sharing. But I also want you to think about what it is we can do. I'm gonna jump through some of the context, but I do want to provide a context. So again, I'm going to say reflect on the gratitude, and moving on from there, I want you to think now about what contextualizing a lot of what we learned already today, but what it is that is exacerbating this whole issue of mental health and stress during the pandemic. And I think it's going to make sense as we get closer to the end. But I need you to just reflect on this a little bit. And yes, it is true that we have a lot of challenges as a consequence of COVID-19, no doubt. And they're social and they're economic and they're a whole range of things. However, I want to also just step back for a split second and say that a lot of we have multiple pandemics playing out, and this has a role to play. But we have multiple pandemics playing out, and I want you to just think back for a minute on how many of them have already existed for a long time before coronavirus, okay? And I'm not going to go into great detail here because we've already heard about it, but we're talking about domestic violence. We know statistically and through research, numbers are on the rise phenomenally. Hunger, by the way, has existed for a long time before the pandemic, but has exponentially increased. If you look at Yemen and look at a lot of the other places, but around the world, hunger is a huge, food insecurity is a huge issue. And at the same time, we're wasting food because we're losing food, also as a consequence of the pandemic. Economics, so global GDP, big time loss, joblessness, we talked about it. Social unrest, this is something I want to talk to you about, because one thing that we're hearing already in the news, and we know had been already projected by a lot of people who were social scientists, that we're going to face a lot more of this. So all of these parallel pandemics are going to be going to exponentially increase social unrest. And we are already seeing it in the George Floyd case in the US, for those who are following it. But this has been unprecedented. We have not seen this kind of, let me say, social mobilization against the unjust world of discrimination that we're seeing today. So here's just a quick look at here the number of people who are going to be pushed into poverty. Also, I want to say, for those of us who believe coronavirus is, treats everybody the same, hey, it's time to open our eyes and realize that it neither medically nor economically nor psychologically nor socially treats us all the same. And we must understand that's only a fraction of society that's able to work from home. So, and it is affecting the poorest and the most vulnerable. And I will be talking to you a little bit about those vulnerable communities here today, although I know we're gonna have a separate webinar on it. But I've been asked to comment on this. And so I'm gonna highlight that. I also wanna say, oftentimes the most vulnerable communities, but certainly, like we heard, the gender, biases and all that we have. We know that substance abuse is going up, alcoholism is going up, and also among women. But there's a range of things. There's misinformation playing out here, where people think, oh, alcohol will help kill the virus, and of course, there's depression and stress, which is further sort of exacerbating the substance use issues here, which are both alcohol and other forms of substance. And I'm going to only just going to highlight this, and I'm not going to get into a lot of detail, but I want to say racism, victimization, and the fact that we're facing humanitarian crises as a consequence of this violation of human rights, and also the fact that there's been a whole range of public health issues prior to the virus that continue. They've gone nowhere. So there are those who are non-COVID patients, and obviously that has created yet another crisis for us. But I'm gonna just touch on the infodemic issue, which is that there's misinformation, there's stereotypes. I know we heard about the stereotypes even in previous discussions today. There's rumors, blaming social media and access to WhatsApp and all the rest of it has further exacerbated this. We live in the information age. But I want to step back and say that that all research indicates that in any pandemic in the past, we've had misinformation. And the fundamental reason for that is unknowns. There are a lot of unknowns. And so people try and pick up whatever information they're able to get. And certainly social media and access to information today has helped to propel information going viral. But this is already a phenomenon that exists. And so obviously fact checking and all the rest is important. And so is stigma. And I'm going to now talk to you a little bit about vulnerable communities and oppressed communities. But I want to say again that these are pandemics that have existed for years on end and centuries before the coronavirus ever happened. And so I'm going to ask you to think for just a minute, but there are people who are dying of stigma, who are dying of hate crime, dying of hunger, dying of violence, and it's not COVID. And I'm going to give you an extreme example, but believe me, we talk to and work with these communities every day of our life. So think about the levels of stigma faced by an HIV positive transgender sex worker who uses substances. This was before the pandemic, and now facing COVID or living or sort of being positive. So so there are a number of levels of stigma that have existed in the past and are further exacerbated by the current pandemic. And I want to also say that we have a lot of people from these communities, these very vulnerable communities, and these very marginalized communities oftentimes, who are in fact the ones who are the frontline workers. Okay, they are the ones who are out there making peer-to-peer contact, implementing these interventions. We know a lot of them. And I want to say that they don't have access to the protective equipment they need. There's, of course, the whole stress of infection, potentially being infected, spreading the infection, all the rest, and dealing with a whole range of other stresses that come with it, which include non-COVID intervention certainly, but also being sort of working with the lack of infrastructure, long hours, and all of us, every one of us, but particularly those on the front line, are witnessing death and disease at unprecedented scale. So and these folks at the end of it, when they start to go out in the field, are the ones who are being blamed as super spreaders. So there is a lot of this, and I just need you to understand the context, because that's where the solutions are going to come up. And so that kind of wraps up a little bit of the contextualization. What I want you to take away is that we have, in fact, a lot of parallel pandemics playing out alongside Corona. But Corona is the new one. The rest of them have been there. And so how do we promote and preserve mental health in the context of the pandemic then? And of course, in the context of our lives as we know it today and going forward. And I need you to just walk away with a little bit of perspective here, you guys. And what I'm going to say to you is that, like I said, a number of these things, including disinformation and humanitarian crises, have been around. But today, the situation is exacerbated, and fault lines are emerging. And for those of you who are following the George Floyd case, the knee on the neck issue has been there for a long time. That is racism and minority communities being discriminated, stigmatized. And what I want you to understand now, and this is really what is most important, that if you think back on history, whether you think about the freedom fight, the fight for civil rights, you think about any moment where things changed, it was when we faced adversity. And in those moments of adversity, people got up, they stood for what they believe in: love, togetherness, solidarity, and taking action. And so what I'm going to say to you is, we really need this pandemic to be one where we join hands and become active players. Remember this: yes, we will all be beneficiaries, but we cannot be beneficiaries without being active players. And I want you to hold historical perspective in your minds and in your hearts, and the gratitude that you have for being here, for being all that you are, and move forward with that. And know that, yes, these issues have existed, but COVID-19 is a wake-up call, guys. Wake-up call. It's time for us to get together to examine what those vulnerabilities are. What are those fault lines? Why are we sitting with a knee on our neck? What are these interdependencies? And how can we get up in solidarity, take action, examine what these vulnerable communities are facing, and how we can be part of a humane response, but do it together. And we really, really need mindful and thoughtful approaches to being able to address this. And of course, we need leadership, but we are all leaders. We are all leaders. And so coming together to make this happen is an absolute must. And here's a chance. COVID has created an opportunity. And that's why I want to say that, yes, there are challenges, but look at the opportunity, look at the light. You don't want to find yourself on the other side of the pandemic and not having moved forward, or worse still, having moved backward. So what can we do? And I don't want to delve into this too much, because we heard so much already of fantastic, invaluable stuff. But you know what? WHO came out with this whole idea of self-care, which was launched, mind you, ironically, just about a year ago. And at that time, we all talked about self-care, and we've been part of that whole self-care thing with WHO. But today, self-care has become absolutely quintessential. And when I say self-care, I mean, everything you wrote down in your gratitude list. I mean, everything from waking up in the morning feeling okay, you know, not being laid up, you know, exercising, meditating, eating, all that we just heard. And I want to underscore that the lockdown, yes, it is part of that self-care, but we must understand that lockdown is not socially disconnecting, but rather socially bonding, physically disconnecting. And I'm also going to say, you know, what we can really do is be part of the solution. Avoid, we can do our part. Avoid propagating that social stigma. Spread information. We've got information in our hands. Let's spread that information. Promote empathy. Be part of the be part of the a solidarity move. Respect. You know, work with communities so that they don't starve, which is what's happening right now. If COVID is not a response, COVID is not an issue. And I'm just going to give you this one quick example of how, when we worked with truck drivers some years ago and we went out there talking about condoms and this and that, they were like, heck, I don't care about your condoms. I don't even know if I'm going to get to the other side alive, wherever the hell I'm driving to. So what I'm going to say to you is that, you know, we need to be able to look at community issues for what they are, work with solutions, be peaceful in it, but remember the moments that change history. Okay, and you can be part of that. And of course, so we don't get misled by information and all the crazy stuff that we see on the internet and WhatsApp and what YouTube and whatnot. Look at credible information, but also, and I know this was highlighted, but being part of that whole response is not only sharing information, but also for those who are sitting home, who may not be in fortunate positions or having jobs or whatever. When and how many times in our lives have we wanted time to be able to build on our skills and our expertise? How many times did we want to be part of something really important? How many times did we want to be part of an exercise where we educate ourselves and make a difference in this world? So here's that moment. And I'm just gonna, I'm losing my control here, sorry. Here we go. And I'm just gonna close out with a couple of things, and I'm gonna say, oh boy, I can't see my own screen. The known among unknowns, okay? As the world grapples with many unknowns, the one thing that is known is that our mental health and well-being will require social bonding, collective action, and support. So let's not forget that. And I'm gonna close out with this, and then one more real quick exercise for you guys. And I'm gonna say, we cannot solve our problems with the same thinking we used when we created them. And that's a quote by Albert Einstein. I'm going to ask you to reflect on that, and I'm going to ask you to close this out. And I want you to think about the one thing that you were doing or that you can think of doing, and I hope you'll practice to preserve and promote your own mental health and well-being. And you play an important part in society, so obviously you're supporting a larger society in the process. So I'm going to ask you to just think about it, and I'm going to take a few seconds before I close out and say, could you write that down? Thank you.